The summer before my senior year, I begged to be institutionalized, and I asked the psychiatrists on staff, please wean me off my medications. Please reevaluate me because I don't think I have bipolar disorder. And I didn't. I didn't have it.
Imagine you're 10 years old and you've survived something no child should ever have to face. Childhood sexual trauma. At school, you're having trouble concentrating and your behavior is difficult. Both completely normal responses to the pain you're carrying. But no one knows how to help you cope, not even your parents. Wanting to do the best they can for you, they take you to a psychiatrist for an evaluation. That's when the medications start. It's supposed to help, but it doesn't. And as your parents and doctors search for answers, your doses increase and more meds are added. By the time you reach high school, you're now on a cocktail of meds, antidepressants, mood stabilizers, ADHD meds, and even antipsychotics. The side effects are hitting hard and your weight spirals out of control. You develop mood swings and behaviors that simply aren't you. It's as if the drugs have taken over your identity. You struggle to focus in school and you find it nearly impossible to make friends, and your self-esteem is just falling apart piece by piece. Now, deep down, you know something is wrong and you can feel it, but no one believes you. Your family, your doctors, they all insist you need these meds to function. They warn you not to stop, and they even discourage you from thinking about it. But by the time you turn 20, you've had enough. You make the brave decision to come off the medications, despite what everyone around you says. You do it all alone, driven by the unwavering belief that this doesn't have to be your life, and that maybe there's another way. So what happens next? Well, today we're going to find out through our interview with Kassie, someone who has faced this exact battle. And before we dive into this interview, I want to make it clear, coming off psychiatric medications is extremely dangerous, and it should be done under the care of a doctor and with supportive family. So Kassie, take us to the beginning. How did you end up on medications to begin with?
When I was born, my mom definitely noticed I was having some sort of issues. I was a very fussy baby and I had feeding issues. And I just had a lot of challenges as a kid. Difficulty focusing, hyperactivity, just different things. And I had suffered some trauma at the hands of, I guess, certain family members that were probably doing things to me they shouldn't. And that was kind of affecting my emotional and behavioral health in a way too. At some point, it was interfering with my ability to go to school, and my mom took me in for neuropsych evaluation, and I think they had also suspected ADHD. They tried me on one of the medications for ADHD, and I did not respond well to it at all. So they just assumed I had bipolar disorder, and they started medicating me. And,
how old were you at the time?
About 10 years old, probably.
Okay. So you suffer some abuse at the hands of family members, and you're having some behavioral problems perhaps, or you're having difficulty concentrating, and you get put on ADHD medication. And you say you were 11 at the time? 10. 10, okay. And so walk us forward from there. How did you end up on so many medications?
This is a list of like my hospitalizations from childhood all the way to young adult. It's like a lot, you can tell.
Yeah.
The first thing that they put me on was Zoloft, and it's funny because it was happening very shortly after I lost my grandfather to lung cancer, and he was very close with me despite everything I was going through. He knew how to get to me and teach me lessons, social skills, whatever, without shaming me. And when he died of lung cancer, that was devastating. So the first medication they actually tried me on was Zoloft, and I think that was for depression. And I broke out in a rash. So they switched me to Concerta and eventually put me on Celexa and Lexapro. And then they just kept medicating me from there.
And so what were they medicating?
I don't know.
Okay.
I have several neuropsych evaluations, and I found one recently from when I was 15. This is well after they started me on meds. It looks like symptoms of autism spectrum disorder, struggling to focus, meltdowns, difficulty with... I'm actually looking at this, and it looks like Psych Med. Like, at this point in the game, it actually looks like Psych Med. Side effects like restlessness. But, I mean, there's a ton of side effects here. Like, I don't even know how much of it was me and how much was the meds, because it was 5 years into the medications. So I can only presume that it was just basic ADHD and autism-like symptoms that were getting me medicated.
Kassie, could you just tell us some of the medications that you were given while you were in school growing up?
There's a lot of them, so
sure.
Buckle up.
Yeah.
Zoloft, Concerta, Celexa, Lexapro, Risperidone, Neurontin, Depakote, Seroquel, Lithium, Topamax, Lamictal, Trileptal, Abilify, and Adderall. Towards the end of my medication journey, before what I believe was protracted withdrawal, possibly, I was on Risperidone, Buspar, Pristiq, Klonopin, and Depo-Provera, which is probably not the greatest thing to combine with all those meds I had, but...
Yeah, so that's, for those of listening out there, that's the kitchen sink. Apparently, we've got antidepressants, mood stabilizers, ADHD meds, antipsychotics. And so that is a lot. Kassie, looking back, what was going on in your life to have you end up on such a cocktail of medications? Like, how do you even understand that looking back at it now?
I grew up in a home in which my parents' marriage was strained from day one. It was one of those marriages they stayed together because my mom found out she was pregnant with me. And they did their best to kind of make things work. I had a very loving family, but there were some members that didn't keep their boundaries and had ill intentions. So I suffered sexual trauma very early that kind of like piqued my curiosity early and got me in trouble. And I was yelled and shamed at for it. So that kind of added to my problems. In addition to that, the closest family members that I had died of cancer quite early. Right before the start of my medications, I lost my grandfather, and a few years in, I lost my aunt. And both of those were safe havens for me because they just got me, and nobody else really did. So I definitely had a lot of meltdowns. I had trouble focusing, maybe was showing a little bit of signs of promiscuity, which is a little hard to talk about, but I mean, that does happen to some children. From what I understand in the research that I've read on the internet, like you can have children shut down or children just kind of become hypersexual.
And now I know you grew up in a conservative household. I mean, how did all of that play into it as well? Because I mean, this is a very taboo topic. I mean, particularly within more conservative homes. What was that like? It
was very difficult because you definitely kind of felt like there was something off about you and you were afraid to talk about it. And it's actually pretty wild, to be honest, because at some point in my journey with conservative religion, I came to the conclusion that I wanted to adopt the notion of my faith to wait until marriage. And so I really tried to hone down and discipline my thoughts and my actions. And I was having a really hard time with that. And I've often wondered if the combinations of medication I was on just kind of added to that, because the few of them I've seen have the uncommon side effect of increasing, like making people hypersexual, if that makes any sense.
Yeah. Well,
And
let's talk. Let's talk about the medications, but I do want to just affirm that what you said is completely correct. I mean, what we do see in child survivors of sexual trauma is exactly what you said. That one of the reactions to that can be increased interest in sex, and I always remember that that's like a red flag. When I was being taught, if you have precocious, young children being precocious or knowing about sex or asking about it or they're interested, things like that. It's a sign to ask about sexual trauma. So you would certainly not be alone with that. That's a really common thing that I've seen. But the other thing that you mentioned is really interesting because a lot of these medications can make people hypersexual. Mainly the stimulating medications, things like antidepressants and stimulants, they can have that side effect. And so, that might be a good segue to talk about the effects that these drugs were having on you, because, it sounds like you got started on them when you were 10 because people wanted to help you. They wanted to help you with the medications. They had good intentions, but it didn't really turn out that way. So maybe you could just describe, like, what was the impact of being on these medications, I guess, throughout your childhood from age 10 onwards? How do you recall their effects?
it really wrecked my self-esteem. It kind of confused me because I didn't always feel in control, if that makes any sense. I felt like with the problems I already had, it was kind of like throwing a bomb on a small kitchen fire, if that makes any sense.
Sure.
And that's kind of with everything, including the issues I was having as a result of the childhood trauma. And I ended up feeling like if I didn't get my medications right, I wasn't going to be able to have a normal life, and I wouldn't even be worthy of love, because it got to the point where
Well, actually, let me follow up with that. Okay, so you're on a cocktail of antidepressants, mood stabilizers, antipsychotics. How does that affect like a child's relationships with either their friends or their teachers? What is it like to be on so many medications and do all of that?
I don't think that I was really able to socially develop properly. And I don't think I was able to comprehend and learn from social situations because I was just so drugged out. I was tired. I was fatigued. I was in the hospital one time because the medications actually made me aggressive. So as a child, I felt like, in a way, I'm not going to be fit for society and I'm never going to have a normal life, and my parents won't love me if I can't behave. So we've got to get the meds right. But on the other hand, the meds were making me worse at the same time. So I bought into the belief that the getting the right med combination would actually work. And instead of it working, it just got worse. One of the things that the medications did to me was it made me compulsively eat. And I went from being really thin and really just not liking to eat because of texture sensitivities to compulsively eating anything at any time, to the point my mom had to actually put locks on the closet. And so I went from being like rail thin to having like fat like falling off of me,
Wow.
hanging off of me.
How heavy did you get when you were at your biggest?
I don't know my weight. I just remember some of the pictures my friends from grade in middle school showed me of after it was happening. And I remember that before this, I was at summer camp and guys were writing about me on the cabin walls, and they wanted to be my boyfriend, and they were crushing on me big time. And I actually did have like childhood boyfriend, if you will. And then the next summer after the meds, my body had changed so much. Like, he looked at me with a look of horror in his eyes, and pretty much we didn't talk after that.
I mean, it's so heartbreaking because I think about just how difficult school can be. And so not only, I guess, you're suffering from the side effects of weight gain, which are really challenging to anyone's self-esteem, but also if you're having any behavioral problems as well, disinhibition from then, you're acting in a way that's out of character for you. And kids remember these things. I mean, when someone's like that, and I imagine, I don't know if you dealt with any ostracism or, people maybe not wanting to be around you because of these outbursts that were out of your control. And so I just imagine it being like a stick of dynamite for someone who's young. They've already had sexual trauma and they're just trying to integrate into the school. Like you said, a bomb on a small fire.
It's exactly like that. People did not want to be around me. I did not know, like, I couldn't, like, I felt like I couldn't win with my behavior, no matter what I tried to do. It really was like that. There's just so much. It's hard to narrow down the memories to tell you everything.
I mean, if you were to think about one moment that was particularly that really stands out as being, one of the most challenging things that you dealt with in school because of the medications, what story would that be? What was one of the hardest things that you went through?
It's all of it, honestly.
Yeah.
I lost my ability to be athletic because before medications, I was really athletic. I was into sports. I was into art and acting. I was into gymnastics. I was an exceptional swimmer. And I had standardized testing showing that I was in a 12th grade reading level in 4th grade. And so what it did is it really it took away my academic ability. It took away my social ability, my ability to learn how to socially perform. It took away my appearance. So inevitably, it just basically just kind of like at various times on certain combination of the drugs, it would raise my sex drive while lowering my sex appeal from an early age, which when you're young, I mean, you don't want to be like doing inappropriate things too early, but when you get into high school and then you start entering like college age years, it's not that great. So in a way, it was just kind of providing developmental wrecking balls.
Well, that makes sense. And I mean, we talk a lot about, I speak to a lot of people who have PSSD on this channel, which is the permanent sexual dysfunction from the antidepressants. And they also, a lot of the times they have blunting. I mean, sexual dysfunction and blunting can just happen on these medications. And quite a few people say that they did feel developmentally delayed, that they weren't doing things when everyone else was. They weren't learning how to regulate their emotions in the way that other people were. And they were almost playing catch up when they needed to come off. I've had some people say, hey, I'm 40, but honestly, I feel like I'm 25 because that's when I got on the medications. And now I'm kind of learning all of this stuff again.
Yeah, I struggle to act my age. I want to be my age because I want to do things but like, I feel like there's so many things. So recently I've joined a new church because I moved and I've been involved in their young adult group and I'm noticing different things. It's funny because I'll be like, oh, this made them react like this. So they didn't like that. So I need to respond like this. And so then I'll do it and I'll get a better response. Mm-hmm. And then I realize this is what I was supposed to be doing from kindergarten to 12th grade. This is what I'm supposed to be figuring out. That was not occurring because I was so drugged up. And the drugs were giving me side effect after side effect. Some were behavioral. Some were not.
Yeah.
And I'm having to build my self-worth and build my identity and figure out how to be a human, because I never got even that chance. Nothing made sense. I was just given these drugs so early.
And now, Kassie, what shifted for you? I mean, when was the turn? Like, what was the moment when it was like you realized that the drugs weren't helping you? Because I imagine for a lot of your youth, you were maybe deferring to the doctors and just saying, "Hey, these guys know what they're doing. Our parents know what they're doing, and they want to help." But when did things shift and you started to question whether they were actually harming you?
In high school, my mom was encouraging me to read Jane Pauley's book because she was diagnosed with bipolar disorder, and that's what they had put me on medications for. And I read her autobiography and realized I wasn't resonating with it. And I just woke up one day and just felt kind of weird. I was like, it feels like there's this chemical anxiety. And the notes that I sent you, you can just kind of see the progression of the side effects. And I'm just going to be honest with you. I feel like this might be a side effect, like a long-term side effect of the medication. I can get it out on paper, but I can't always get it through my mouth. And I just wanted to ask you if you've noticed anything like that while working with.
What I know about your story, Kassie, is that you go on and you end up developing a protracted withdrawal injury. And part of that can be there can be some cognitive dysfunction that happens after that, and it eventually goes away. But the other thing I actually didn't ask you about is, are you still on medications now?
No, I'm wondering if I have permanent disability, because when I, very shortly after I was coming off my medications, they were showing, the results were showing slowed processing speed. And I took that same test again in between 2019 and 2021. I'm not sure the exact date. And there was a lot of cognitive function that had improved, but the processing speed was still low.
What I've seen with people with protracted withdrawal is they make a full or near full recovery over time. It just takes some time. And sometimes it can take several years, but keeping a healthy life, keeping a healthy diet, you just keep on going. It comes back online. I mean, that's what I've seen. But to not get off track, I do want to ask you though. So you wake up one day, you read this book, you're not identifying with the author, and so you start to question it. What was the journey from then to coming off? How did things evolve after that?
So what really got me is I just wasn't cognitively progressing in school. I was so sedated, especially in the mornings, that I would not be able to stay asleep in class. I actually failed classes, and specifically driver's ed. So I had to not drive, which was a blessing because I shouldn't have been driving with how bad my symptoms were. I felt like I was neurologically declining, and I was putting in a bunch of effort for very little.
You were trying, took you 10 times more effort than other people who weren't jacked up on a cocktail of meds.
Yeah, so it would take me 3 hours to get through an assignment that should take me 15 minutes, and I would be going for A's and B's, and I would get C's, D's, and F's. I was completely just out. And I started feeling like I was experiencing rapid cycling on these drugs and developing severe chemical anxiety. And just my coordination was off. And it was... I just had this feeling that if I didn't come off the medications, I was going to die early with zero quality of life. And like I said, the bipolar disorder was just not resonating. I felt like I couldn't keep up because I had been chemically slowed down too much.
Kassie, let me ask you this. Were your parents in agreement with this when you started questioning this? And saying, hey, I don't think this is going the right way? No, okay. What was that like?
No, and it was scary for me because I would take Seroquel at night and my throat would it wouldn't close, but it would seize up, and I'd just kind of slowly black out. And I was really frightened. And so I didn't know what was going on. So I looked up the medications, and I would tell my dad, hey, Dad, I think this is happening to me. And my whole family thought that I was just imagining it and being a hypochondriac. So they honestly thought that I needed the meds. And it's kind of odd because it's like, my father told me the psychiatrist said you can raise or lower the medication as needed. And so my dad would do that based on my behavior. And that didn't work out very well because I could actually like physically feel it in my body when it was like raised and lower, just like the smaller doses. So I don't think they could tell the nuances the way that I could. They were reading this as she needs more medication because it's not working type of thing. So I think they got lost in what was me and what was the side effects of the medications and what was like versus normal puberty for a trauma survivor.
And I mean, there's a few things that I want to touch on. I mean, first with the Seroquel, that throat thing that happens, I mean, the Seroquel can cause something called esophageal dysmotility. Well, all antipsychotics cause movement disorders. And one of those can actually be of the esophagus. You know, people can have a hard time eating food. It can feel like their throat is closing up. And it can be often overlooked sometimes by, I guess, family members, but also doctors, especially if someone has a psychiatric diagnosis. I mean, if they're carrying a bipolar or, gosh, a schizophrenia diagnosis, when these things happen, they're written off and they say, well, it may just be some kind of delusion the person's having. And it's almost like gaslighting, really. And that sounds like some of that was going on where things were, you were starting to suspect the medications were causing problems, but people around you were just defaulting to, oh, Cassie's mentally ill. She probably needs more.
I really feel like the medications progressively made me more mentally ill than I already was. Yeah, I think that what you're saying is accurate.
How did you come off the medications when you eventually realized it was time? Did you do it on your own? Was there any family support or any doctor support? What was that like?
No. So basically my senior year of high school, I started becoming extremely afraid of my future because I could not socially perform. I could not cognitively perform. Physically and neurologically, I felt like I was declining. I couldn't stay awake. And I was like, how am I supposed to go to college and get a job? How am I supposed to form healthy relationships and stay away from predators when I'm like this in the state? And my family was oblivious to what was happening to me. I felt like I was slipping between the cracks, completely unseen. My senior year, like the summer before my senior year, I begged to be institutionalized. And I asked the psychiatrists on staff, please wean me off my medications. Please reevaluate me because I don't think I have bipolar disorder. And I didn't have it. But they really didn't figure that out until like 4 to 6 years later because the hospital basically told me that we can't really keep you long enough to taper you slowly. And
that's true. They can't. Yeah. Most hospitalizations are about 5 days now. It's not long enough to do anything, really.
Yeah.
So what happened when you did come off? I mean, did you do it on your own? Like, what was that like?
Yeah. So I refused meds at the hospital when they told me that they couldn't help me. I panicked and didn't know what to do. And so they kicked me out and I just went off the rails. Really stopped taking the medication. My behavioral problems got worse. I think there were times I like hit my sister and I was just out of my mind. I was like freaking out about everything. So the first attempt to come off really didn't go well. And so I actually had to be moved from my original base college to my to a new school that was like locked down for troubled kids. And my mom, I was living with my dad at the time alone. My parents had separated at this point. And my mom came into the picture and was like, you need to go back on these medications or you need to leave the house. So I tried to go back on Seroquel, and my symptoms came back and got worse, and I panicked. And I said, Mom, I can't stay on this. So she basically gave me the ultimatum that I needed to leave the house. And so I had to move in with a boyfriend at the time. Like, he took me in. And I had to scrape through the rest of my high school semester. And my senior year, I lost like all the perks. That's the year that you do all the fun stuff. You dress up, you do the events, they do special senior stuff. But I was also taking the most exciting courses of my life at that time. So I had signed up for chemistry and a human anatomy course. I knew what I wanted to do for my future. I had wanted to go into the medical field. And so I was taking courses to help boost my college performance. And I lost all of that. And there was a brief period of time where we were trying to switch psychiatrists, and the previous psychiatrist before we left had prescribed me Sapphiros. So I had been on Seroquel and Sapphiros. There was an overlay for a brief period of time, and that was making me worse because I was on 2 antipsychotics at one time for a disorder I didn't even have. And it was basically a mess. I spent a lot of time on the floor. I started having issues with like histamine intolerance, and I was like popping antihistamines just to survive. And the teachers at the lockdown school, basically they looked down on me, and they were very condescending, and they basically shamed me for trying to come off my meds. And they're like, you have a little sister at home to think about. And the other thing is they literally thought it was psychosomatic, and I was just taking antihistamines to make myself feel better. So at this point, I am trying to taper. I felt like I was kind of waffling like through my taper process, on and off the medications, trying to figure out how to safely come off. But like the side effects of the medications had gotten so bad for me. They were affecting my, I had the common sense, but I didn't have the ability to act on it. And things were just, the symptoms that I was experiencing were so bad I couldn't keep track of it. So,
Kassie, let me ask you, when did you eventually get off all of your medication?
So after high school, I bounced around to like 3 different homes, and nobody knew what was happening to me. They all thought it was my fault. So I ended up back in the hospital, and they put me on twice as more medications than I was originally put on. So I had gone down to just being on like Lexapro and lithium. And so my first attempt to come off didn't really work. So then I was on twice as much. So I graduated high school in 2010, and that's when this started. And I was able to start coming off around 2012, like late summer of 2012.
Yeah.
Because the more medication they put me on, the worse my mental health got, the worse my physical health got, the worse my neurological health got. And I just got to the point where I was like, I don't know where to go. I don't know what to do. So I stopped them around 2012. And that was after my psychiatrist fired me because I was telling him I need to come off of these medications. And this is the second psychiatrist that I had. So this is like, I've gone through quite a few at this point. Literally quit on me. And so I just cut cold turkey after that.
And what's that like to go off lithium and Lexapro cold turkey after being on it for what sounds like 10 years or more?
So lithium and Lexapro, I don't even remember what happened with those, because those were what I was on before I landed back in the hospital, and I was put on like another large cocktail of drugs.
Okay, so you're coming off a different cocktail. So what happened when you came off that big cocktail of drugs after you were fired by your doctor?
You are correct, though, because my records from 2011 do indicate that I was on risperidone, so I guess they did keep me on it. I'm sorry, like the drug effects of the medication has my memories. They're just kind of like smushed into each other. It's really hard to pull them all out.
Yeah.
But yeah, no, it was awful. Like I felt like I went crazy Does withdrawal psychosis actually exist?
Yeah. Some people, when they're coming off psychiatric medication, they develop chemical terror or anxiety is what I would call it. It's a really extreme, inconsolable form of anxiety, and it can actually border on paranoia. I have a lot of people who I talk to who have really horrific withdrawals, especially people who develop protracted withdrawal, where they're so anxious they become paranoid. I mean, they think that they're going to be arrested by the police. That you cannot reason with them. They think everyone hates them. And yes, so the level of anxiety can actually border on paranoia in withdrawal.
Yeah, that sounds about right. And I would have actually progressive, like I would have panic attacks one after the other. Sometimes they would build, and they felt very chemical in nature. And there was not very much I could do. And I believe I would walk miles, but I could eat very little. Mm-hmm. So I was like losing weight, and I had to walk for miles and miles. And
where were you living when this happened? Because it sounded like you were estranged somewhat from your family because you weren't complying with the doctor's orders.
My first attempt, I was kicked out of my home, and I stayed with a boyfriend at the time. When I graduated, I stayed with a church family. After the church family didn't know what was going on and couldn't handle it, they told me I had to leave. I ended up back in the hospital. And then from the hospital, I went to my grandmother's house. And I was attempting to basically learn life skills. And I was taking buses to college while I was neurologically declining and getting worse. It got, like, the stiffness got so bad I couldn't even hold my hands up to wash my hair thoroughly. So I always had like greasy hair no matter how much I showered. Number of places I lived, it got to the point where, like, actually during that time, there was a suicide attempt, and I kind of just ended up not going through with it. And after that, my family did accept me back into my home, but they still didn't understand my symptoms. I was having really bad sensitivity to light, pain with sound. I couldn't really handle or have like extreme emotions. And so they thought that this was all something self-inflicted because I wasn't taking the meds. So whatever they felt. And
just to jump in there, Kassie, I mean, those symptoms are really common in a condition called protracted withdrawal. So when people come off medications very suddenly, especially antidepressant medications or benzodiazepines, it's almost like they get a concussion or a brain bruise, but they'll develop, light sensitivity, ringing in their ears. They have intense anxiety that goes on for a very long time. And along with that, they can't handle strong emotions. Many people can't even watch certain things on TV because it becomes too stimulating for their sensitized nervous system. And this condition is really hard because it doesn't go away if you get back on the drugs. Essentially, it is like a concussion. It can take a long time for it to gradually improve over time. And it sounds like that had happened to you if you're having a lot of this neurological sensitivity when you came off the drugs.
Well, the funny thing is this was starting when I was still on that cocktail from the being in the hospital and before moving in with my grandmother. Mm-hmm. So I'm wondering if I had sustained the injuries and it was just getting worse on the more drugs. And then when I finally started coming off the second time around 2012, when I was bouncing between my friend's home and my family's home, I'm wondering if it just made it worse.
That can happen. And so, Kassie, with your history of being on and off medications so much, it can happen like that. I mean, if you were jerked off a medication, that's one injury. You get put back on them, you get taken off. It's commonly referred to as kindling. And gosh, there's just something bad about being on medications and having the dose go up and down constantly. It does make people sick over time. So it is very possible that may have happened with your history.
Yeah, because they were constantly changing the medications, and then there was kindling. I think that happened a lot. That happened during the first time I was trying to come off, and it happened a lot when I was trying to come off the second time, because I had 2 attempts before I was finally off of these things.
Tell us about that. I mean, what has life looked like for you since you've come off these medications, which you essentially took, from 10 to it sounds like 20, something like that. How did, so you come off, you've got protracted withdrawal, it sounds like. How did your life unfold post-drugs?
So during withdrawal, I was completely crazy. It took me about 5 years to start having any semblance of sanity, and being able to really, start developing any kind of like respect in public. I had some underlying medical conditions that, like, frankly, are genetic that had gotten misdiagnosed, and I could not get any doctors to take me seriously so I could get diagnosis and treatment, because I had been in the medical system under psychiatric care, and they knew that I had come off the medications against doctors' advice. And so they just assumed that everything was in my head too. And then I was like locked into like anxiety. It was hard to even communicate what was happening to me. When I was going through the protracted withdrawal process, I actually got injured because I was having so much muscle tension and twisting. I sought out a chiropractor. And because I had an undiagnosed connective tissue disorder called Ehlers-Danlos syndrome that we didn't know about, I actually developed cervical instability that it wasn't even diagnosed till 2018, Josef. So I developed this in 2013, about a year into protracted withdrawal. And it was messing with the blood flow to my brain. It affects the vertebral arteries. They were being compressed, not fully. Because I'm still alive, obviously. I haven't died of a stroke yet. But the symptom, it's a little funny, but it's kind of awful too. When you look back at this, like, you learn to see the humor in it. I literally was that patient who could not keep their head on straight. So I was completely discounted. I was in like all this pain. Nobody believed it. I couldn't even and I think it really, the lack of diagnosis and proper treatment because of the severe effects of the medication, because of being locked in that system, I think it extremely delayed recovery of withdrawal of the drugs for me. And I'm still experiencing sensitivity to flashing lights. I'm afraid to experience emotions because they're painful. I still, even at 32, like 15 years later after this, I'm still sensitive to lights. I saw a neurologist recently. They did a 72-hour EEG, and they're seeing signs of psychogenic seizures. So I've had to wrestle with flashbacks, with trauma, with fear of the doctors. I've had white coat syndrome. I have a nice group of friends, but it took a while to really find them. It's delayed my education. And it's made school quite a bit more difficult because I'm managing the injuries I got, trying to find relief for the protracted withdrawal. And I'm working through psychogenic seizures. And then now I'm managing the underlying genetic condition that they missed from the beginning. Okay. So it's kind of just been storm after storm after storm. And I wasn't able to really get to a point where I could have breathing room until last year. I moved down to Florida with my family. And I was able to really just kind of start recovering and starting to make sense of all this. And I could not, for the life of me, I couldn't utilize therapy, which is like more of a strong point of the mental health field, as a child because of misdiagnosis and just being drugged out of my mind. But I also couldn't really coherently sit down and communicate with therapists or anybody because of how bad the withdrawal was. And then, like I said, we went from withdrawal into cervical instability. And I just didn't really have a chance. And then by the time I started regaining some semblance of clarity, it took me years to even have the bravery to be like, let me try to settle down and try therapy. So really, I'm 32 now. This started really early, years, like over 10 years ago. Now I'm starting to be able to turn into a functional member of society, have a better quality of life. And it's not perfect. You know, I don't know if I'll ever be the same again.
What you've been through, I mean, is unbelievable. I mean, really just from the very beginning of your life, into 10 years of, more than that. I mean, from 10 up to, sounds like last year, just medical trauma, gaslighting, drugging, protracted withdrawal. The fact that you're still here is just incredible, that you managed to essentially just decide to keep on going despite all of this. I mean, it sounded like it also probably tore your family apart as well. You were kicked out, kind of pitted against each other. Tell me about that. Like, what has it been like to even talk to your parents about this now that you're coming out of it?
The way that the medication affected my behavior traumatized the family. And from early on, because they didn't even diagnose me properly, the therapy was not matching my diagnosis. The medications were not matching my diagnosis. My parents, it affected their ability to parent me. They were putting their best foot forward, trying to help me. They wanted me to have a good life. They were hoping that the meds would stabilize me and bring our family together. But how can you parent somebody properly when you don't know what's going on? Like, they were misapplying their own parenting, which I think would have been really, what they were doing would have been very good if the diagnosis had been proper and I hadn't been drugged out of my mind. But
do they acknowledge that now, that, you know, looking back on where you are now and how you were back then, that the drugging wasn't good for you?
I think my dad is getting it. My mom, my sister, you know, they've had to use the medications for brief periods of time. And I don't think they see it yet. I don't think they see how the medications have sabotaged the family and sabotaged me. And I don't think they realize the dysfunctional cycles we got stuck in. As a result, I think there's still trying to come to terms with just how badly this messed up and further made our family system more dysfunctional. But I think as a parent, it would be really hard to sit there and be like, I sabotaged my own doctor, I gaslit her, and I blamed her for something that wasn't her fault. I think that's really hard for a parent to kind of swallow.
For the people out there who may be going through something similar, they've been polydrugged, and maybe they're protracted at the moment. Tell us about your life now. I mean, if there are positive things to share, what have you gained by coming out the other end of this? I know you mentioned in the last year things have improved for you. Paint a picture for us. What's your life like now, off drugs, kind of through protracted withdrawal, at least the worst of it, maybe some lingering things going on? Tell us about that, Kassie.
Yeah, so I've just kind of gained a greater appreciation for certain things in life. I feel like I've gained a sense of purpose, honestly, because what I went through completely changed me. Watching what this did to my family now, because we're currently still rebuilding our relationships, and I'm having like a lot more success with my dad than my mom. My mom and I were slower. We're working on it, but it's seeing what this can do to families that love each other and want to be there and do what's best for each other. It gave me a reason to keep going. So I've learned that basically medications, if they're going to be helpful brief periods of time for the right diagnosis. I've learned that I want to go into the med field. I want to help people going through withdrawal, and I want to help people get the right diagnosis. I wouldn't be here without my friends. And I heard it put one time by somebody that the best doctors were once also patients, if that makes sense. Because I feel like I can provide an empathy, like, to people who are going through something that most people don't understand.
I see that's often the case. I mean, someone that comes to mind is Laura Delano, who was massively polydrugged through her teenage years and has now contributed in a major way to the psychiatric drug-harmed community. And gosh, if that's something that you want to do later on, Kassie, we'll be cheering for you.
Yeah. Hey.
On that note, Kassie, I just want to say thank you for coming on and sharing your story. We haven't covered people who've been polydrugged during childhood before, and it's great to get your account. And I think it's a really important story to share. So thank you. If you're interested in the real life stories of people who have survived harrowing experiences with psychiatric meds, be sure to check out this next video.